Anatomy Trains invites you to take your career to the next level with Anatomy Trains Structural Integration, ATSI. We're kicking off the next training this September in Maine under the guidance of Tom Myers and our expert team. Come map the pattern and shape the change in this transformational 3-part certification program. Visit anatomytrains.com for details. Do you need help with marketing, new clients, or online reviews? Massage Book is your solution, streamlining all the challenging aspects of your massage therapy practice. This powerful software simplifies scheduling, payments, and marketing, allowing you to focus on what you do best, helping clients live better. Visit massagebook.com, create an account, and transform your practice today. Don't wait. Give it a shot today.
Hi, and welcome to I Have a Client Who, Pathology Conversations with Ruth Werner, the podcast where I will discuss your real-life stories about clients with conditions that are perplexing or confusing. I'm Ruth Werner, author of A Massage Therapist's Guide to Pathology, and I have spent decades studying, writing about, and teaching about where massage therapy intersects with diseases and conditions that might limit our clients' health. We almost always have something good to offer, even with our most challenged clients, but we need to figure out a way to do that safely, effectively, and within our scope of practice. And sometimes, as we have all learned, that is harder than it looks.
Dear listeners, if my voice sounds a little different from what you're used to, I have to apologize for that. I am just coming off of being really sick with some sort of upper respiratory infection, and I'm really glad to be fully functioning again with virtually everything except for my regular voice. That won't stop me from bringing you another episode of I Have a Client Who, and today's I Have a Client Who story is a wonderful success story and also a chance to toot my own horn a bit. And it comes from a massage therapist whose client had a complicated situation. And instead of asking this person's doctor for permission to do their work, they asked for information in order to be able to work safely. And there's a big difference between those two approaches. My continuing education class, A Doctor's Note is Not Good Enough, plays a part of this story too, which is absolutely thrilling for me. So listen on. Our story goes like this. Hey, Ruth, I have a client who... There's my favorite sentence. I've been seeing for about 3 years. He's a 62-year-old male who is very active working a maintenance type job. The only previous surgery I know of was a neck fusion several years ago before he started seeing me. He had a lower back injury at work last fall, and I typically see him every 2 weeks for chronic pain in the low back and shoulders and sometimes legs. I usually perform deep tissue massage, neuromuscular therapy and stretching, and silicone cupping therapy on him. He has reported positive results for pain management and increased mobility. About a month ago, he came in for his appointment on a Friday and let me know that he had just had surgery to have a stent placed in an artery that previous Tuesday. The procedure was attempted first through the wrists unsuccessfully, and then at this later date through the femoral artery by, I think, the use of a catheter. He also said he may have had some clotting near the stent. I was immediately nervous, and I told him that as much as I'd love to help him with his back pain, I didn't feel safe performing a massage on him that day. He was super understanding, and we canceled. I was really unsure what to do, and frantically Googling for the next 2 weeks, and was still hesitant about giving him a massage. I ended up canceling his next appointment too, and asked if he'd be okay with signing a release so I could get more information from his cardiologist. I actually was inspired, finally, to take your class, A Doctor's Note Isn't Good Enough, like I'd been wanting to, and that made me feel so much more at ease about writing a letter to his provider to get more information. Hopefully, I did well. The letter I sent was this: Dear Doctor Name, I have a written release from Mr. Client Name to communicate with you about his medical care. I have attached that release to this letter. I've been treating Mr. Client Name with massage therapy for a few years now, and I wanted to reach out to clarify his current condition and ensure that he is both safe to receive massage treatment and that any necessary accommodations to ensure his safety during massage are met. From what Mr. Client Name has relayed to me, I understand that he had a surgical procedure a few weeks ago to have a stent placed to treat a blockage. And this procedure was done with entry first on the wrist and then the groin area. He said he has clotting at the site of the stent, and it sounds like he might be on anticoagulant medication. Mr. Client Name typically comes in to see me every 2 weeks for management of chronic pain in his lower back, shoulders, and sometimes legs. In the past, Mr. Client Name has seen benefits with our treatment, and that has included management of pain in these areas. I often use neuromuscular and deep tissue techniques to the affected areas that consist of firm to deep compression, gliding strokes, friction, and stretching on the affected muscles and fascia. Sometimes I apply heat or silicone cupping therapy as well. Of course, depending on his current condition, I will adjust pressure, what techniques are used, and what areas I will and will not massage based on what is safe during his recovery. I have a few different concerns regarding Mr. Client Name's safety with massage since his procedure, and I'd like to clarify first where the location of the stent is so that I can use caution or avoid that area if necessary. I'd also like to know your thoughts on any safety concerns regarding massage while this area is healing, especially because massage is thought to increase circulation and reduce excess scar tissue formation. My second and most prominent concern is the presence of blood clots. Massage is often considered totally contraindicated in the case of blood clots because it can and has, in some documented cases, caused a clot to dislodge and result in pulmonary embolism. I want to clarify if there are blood clots present or if the client is at high risk for blood clot formation. Lastly, I want to clarify if Mr. Client Name is on anticoagulant medication, and if so, what duration he will be on that medication. This information is relevant to my work due to the increased risk of bruising. Some techniques, such as cupping, may be contraindicated for this reason. Overall, I just want to make sure I have a clear understanding of Mr. Client Name's current medical condition and his surgical procedure. I want to ensure that I am only treating him if it is safe for me to do so, and that I'm not doing anything to interfere with his recovery. I would kindly ask for a response to this inquiry to my contact info listed above. I greatly appreciate your time and willingness to collaborate with me on this patient's care. Sincerely, Practitioner Name. I did get a very short response back from his surgeon that said, no contraindication to massage. Stent is in the LAD coronary artery. You cannot harm it. He does not have any clots. And that's all they said. So I did decide to go ahead and treat him today. I was careful to use a bit lighter pressure on the neck and anterior shoulders. I confirmed with him that he's on antiplatelet medication, so I did not use cups. The whole situation made me feel weird and like I overreacted in some way, especially after the doctor seemed, in my opinion, a bit dismissive. Anyway, I'd love your thoughts. I hope I did the right thing. Well, before I respond to this contributor's question, let's just say a few words about an LAD stent. The LAD, or left anterior descending artery, is a section of the coronary artery, which I'm sure you remember supplies the myocardium with oxygen and nutrients. If this branch of the coronary artery is clogged with atherosclerotic plaque, then the myocardium is in danger. A sudden complete blockage, as might happen if some plaque ruptures and travels downstream, will kill off myocardial cells, and of course we call that a heart attack. But a slowly increasing blockage can make the heart overall less efficient, so that person will have chest pain and fatigue and shortness of breath and other subtle symptoms. There are a couple of ways to correct this. One is with open heart surgery, where the affected section of the artery is snipped out and replaced with a substitute, and then everything is put back into place and sewn up. Obviously, this involves things like cutting open the ribs and putting the body on a temporary heart-lung machine, and a long recovery period and a high risk of complications, and in the very best case, a great big scar. Alternatively, we could use a large artery to get back to the heart, and using imaging machines, we can thread a stent, an expandable mesh tube, to the appropriate place and hold the artery open in that way, and then the body will eventually absorb that so it won't be a rough surface. It sounds like they tried this using the radial artery first and it didn't work, so then they used the femoral artery, which is very typical. This procedure is not risk-free. Some patients do accumulate blood clots near their stents, at least for a while, until the body weaves this device into the tissues, but the possible complications are much less than for open heart surgery, and the recovery time is minuscule in comparison. Remember, this client went in virtually the same week that he'd had this procedure, hoping for a massage. Really, this is kind of a miracle of modern medicine. I have done other I Have a Client Who episodes about stents in various places, and I also wrote a big article about getting doctor's notes for Massage and Bodywork magazine, and that article has some templates for your convenience, and I will put links to these in the show notes. Here, at last, is my response to our contributor. Dear contributor, yes, it's possible that you are overly cautious, since your work won't reach into this client's chest and physically disrupt anything around his heart. That said, he said he has blood clots, and your caution is 100% on point, and you did exactly the right thing. You went to his doctor for information, not for permission. One variable that you didn't identify that might also have helped you to be more confident is this client's level of daily activities. You said he was in maintenance type work. If he is able to be that active, if he can take a brisk walk or safely get his heart rate up for 20 minutes a day, you are unlikely to put any more stress than that on his cardiovascular system. But if walking to his mailbox or up a flight of stairs makes him tired and he has to stop to rest, clearly his capacity is more limited. I don't know enough about cupping to say with confidence when, if ever, in the context of antiplatelet or anticoagulant use, this modality is safe, so I encourage you to contact your teachers about that. Otherwise, as long as what you do is comfortable, within your client's capacity for adaptation, and doesn't cause bruising, I say go forth and massage. And thank you so much for setting an example that I hope many people will follow. I hope this glimpse into a real-life interaction between a massage therapist, their client, and their client's cardiologist will give you some ideas about how this kind of communication might help in your own practice. And I am standing by to be helpful with that.
Precision Neuromuscular Therapy has been teaching high-quality seminars across the country for over 20 years. Founded by Doug Nelson, PNMT uses problem-solving skills and precise treatment options to get powerful results for your clients. PNMT seminars focus on honing your assessment and palpation skills to precisely target the source of your client's pain while understanding the why behind the what. Meet us in a hands-on seminar or online in the PNMT portal and let us join you on your learning journey. Learn more at pnmt.org.